Dr. John Torres here with NBC News, covering this Facebook Live to go ahead and give you some answers behind the headlines you've probably heard over the last couple of days. Dig in a little below the headlines so you get a full understanding of what they're talking about, what it actually means for you, and give you some takeaway tips when I can. On top of that, I want to answer viewer questions as well. So if you have any questions, please send them our way. They're always fantastic questions, and it's what's on your mind, and hopefully I can get the answers for you that you need to stay safe for you and your family. But first, let me go ahead and talk about the headlines. Number one, you've probably heard about a saliva test that just got emergency use authorization. This saliva test is actually called Saliva Direct. Yale University School of Public Health had developed a saliva test, and the reason people are very excited about this is because this is a test that can be used across the country fairly quickly, and it's a fairly quick test. It's good for a couple reasons. One, it uses saliva instead of the usual nasal or throat swab. That's one, obviously, for the person getting the test. It's good because you don't have to get a swab in your nose or down your throat in order to get the viral sample. Instead, a healthcare worker is going to hand you a sterile container. It could be a cup, it could be a tube, and have you spit into it. Close up the container, label it, and send it off to get your lab test done that way. That's much less invasive and much less uncomfortable, obviously, than getting that swab into your nose or down your throat to try and get a viable sample that way. And the testing has shown that it looks like it's as accurate as what we call the PCR tests, which are the tests that we use right now most accurate for detecting COVID-19. This test was originally used over the last few months with the NBA and the NBA players to try and make sure that they didn't have COVID-19, that they were getting isolated if they did have COVID-19. They developed this test in conjunction with the NBA, again, to use on their players, found out it worked pretty well, and said, we're going to go ahead and release this test across the country. Now, the other reason this is good is because this is not a physical test, as in a lab is not making these tests or a factory is not making these tests and then sending them out. One of the issues we've had with the backlog of tests are what are called reagents. These are the chemicals that amplify the DNA or the RNA material in the virus to try and get enough of that so they can go ahead and test that material. That requires a special reagent or special chemical that has to be ordered from some factory somewhere, some lab that is actually developing this reagent, developing this chemical. What they're doing here instead is they found out a way to do this without that reagent, doing the similar type PCR test, but without that reagent, using what most labs around the country have either on hand or are easily able to order this. So what they're doing is they're basically saying, we're going to open source this. We're going to give this information. So again, it's not a physical test that this group has developed. It is a protocol they've developed. And they're open sourcing this protocol to labs and universities across the country and saying, hey, get ready to start doing this. You can get this emergency use authorization to do it. And once you do, you can start doing these tests. Now, they predict they're going to be able to do 90 tests in under 3 hours, under 4 hours, and the tests are going to cost $10 or less, somewhere in the $5 to $10 range. This is going to be a bit of a game changer in a testing scenario because we can get faster tests. They can be more distributed across the country. Any lab, any university lab that has the type of PCR testing capabilities can do it. They don't need specific COVID-19 PCR testing facilities. And it's going to be a PCR test, which are the most accurate we have at this point. They hope over the next couple of weeks they'll be able to get it out there, get this emergency use authorization. Now, a bit of confusion here. Some people are saying it's FDA approved. It's not approved. It's authorized through an emergency use authorization, which means that it hasn't gone through all the full studies, which usually take 5 to 10 years, and the reason it hasn't gone through the full studies is because we've only had COVID for 7 months. So the FDA is saying, well, let's go ahead and look at it, make sure it's safe, make sure it's effective for what we want it to, or at least safe and effective from the initial data that we have. Go ahead and get emergency use authorization and keep looking at it. But so far, these tests are looking very good, and this test is looking like it's going to add more to this and can certainly help. You can imagine schools, universities, sports teams. This is going to be a game changer in that environment to get these quick tests done very rapidly, very inexpensively, and very ubiquitously across the country. So that's number one. Number two, the CDC, there's been some information out about the CDC saying, hey, you're immune for at least 3 months from coronavirus. But a bit of confusion comes about because that's not what the CDC said. What the CDC said was that if you test positive for COVID-19, once you recover from COVID-19, they recommend that you don't get retested for the next 3 months after that time of testing positive. The reason they're saying this is not because they're saying you're immune for 3 months, but they're saying it because it's possible you could test positive. And what we're finding out is in different parts of the world, people are testing positive even though they don't have active infection, because those tests are detecting some of this viral genetic sampling material that is in their body that isn't necessarily the full virus, but just parts of the virus. And so what the CDC actually said is that, contrary to media reporting, the science does not imply a person is immune to reinfection with SARS-CoV-2, the virus that causes COVID-19, in 3 months. The latest data simply suggests that retesting someone in the 3 months following initial infection is not necessary unless that person is re-exhibiting signs and symptoms of COVID-19. So again, CDC is not saying you're immune to COVID-19. They're saying you shouldn't test within 3 months of getting COVID-19 because it's possible you could test positive and it could be a false positive. So that's headline number 2. Headline number 3. Perhaps you've heard of challenge trials that they've been talking about. Let me explain a little bit about how challenge trials work. So typically with things like the flu or other illnesses we have out there, when they're coming out with a vaccine, they try them on people in a flu season and see if, or in a season of whatever virus they're looking at to create a vaccine, they'll try these clinical trials, phase 1, phase 2, phase 3. They'll basically give somebody the vaccine they're producing, they'll give other groups a placebo, and they'll send them out essentially into the wild, into populations that have active infections of whatever virus, the flu, whatever one they're looking at. Then they'll see if the people who got the vaccine end up getting it less often than people who didn't get the vaccine. But the problem comes about if there's not enough active infection happening at that time. What they'll do are what are called challenge trials. And challenge trials mean that they give them the vaccine and then they give them the infection. They actually give them the virus to see if that vaccine can hold off the virus. And that works for some viruses, but it works for viruses that we know have low death rates and we do have some treatment for that can help people. And they'll give them to groups that typically aren't affected by that virus as much. Here's what issues come in with challenge trials for coronavirus and why they're not being done at this moment. And the reason it hit the news is because there's an agency that's actually developing the virus, a lab that's developing the virus in order to start doing challenge trials if that need comes about. But most experts are saying we're not even close to needing those challenge trials at this point for a couple reasons. One is coronavirus is pretty rampant throughout the country and throughout the world at this point, so it's easy to get groups that can get vaccinated or get the placebo, get out into normal populations, and get exposed enough to give good data and good information. On top of that, you should never do a challenge trial. You should never deliberately, and this is as a physician, one of the oath we take, essentially do no harm. So you should never intentionally infect somebody with a virus that you know has known complication, a known death rate, and no known cure for it. Ethically, that is not something you can stand on. And so because of the ethical considerations and because of the fact that right now coronavirus is rampant, we can get good information, challenge trials are not needed. But again, this one lab is developing the virus in case the challenge trials need to come about. But at this point, they're not here. Most experts are saying we do not need them at this point, and they should not be done. So again, the headlines: number 1, the saliva test, it's coming out. It should be here within a couple of weeks. It's going to be inexpensive. It's going to be quick. It's going to be as accurate as any of the other tests out there, and much, much easier to get. Because again, you just spit into a tube or a container instead of getting a swab in the nose or the throat. CDC, they're not saying that you're immune for 3 months after getting COVID-19. They're simply saying don't test for 3 months after getting COVID-19 because that test could give you erroneous information. And then the challenge trials we just talked about. Ethically and from a population standpoint and from a scientific standpoint, not needed at this point and should not be done at this point. So now let me see if you guys have any questions, and they're always fantastic.
Will running my air conditioning help prevent me from getting COVID-19?
So the question is, will running my air conditioning help prevent me from getting COVID-19? The answer is yes and no. And the reason I'm saying yes and no is because it depends. Now, one thing we do know is that outdoors, COVID-19 spreads or coronavirus spreads less than it does indoors. And so getting outdoors, that fresh air where the air moves about, that virus can dissipate quicker. It can spread over larger areas, a smaller particles, so people aren't as affected by it. Indoors, you tend to be trapped, the air tends to be recycled, and so that's where air conditioning could hurt or could help, and it depends. What we have found out is that ventilation systems, if they're not done correctly, can actually move the virus around and keep it suspended in the air a little bit longer, especially in hospital settings. And so the concern here is making sure that your ventilation system is set up appropriately. And that means a couple of things. One, if you can open a window and get fresh air moving in and out, that's great, because that's certainly going to help move the virus out and dilute the virus that's already in there. Number two, your air conditioning system, you want to make sure that the filtration of the air conditioning system is current and is appropriate. So what you're looking at are a couple different things. Most home systems can't use what are called HEPA filtration, HEPA filtration. The reason they can't use HEPA filtration is it tends to be a thicker filter that is denser, and so the air has a harder time moving through it. And the air conditioner systems in homes, the HVAC systems, aren't strong enough typically to use that. Some can, some can't. If you can't use a HEPA filter, and HEPA filters are what hospitals use, what a lot of offices and buildings use, because they do have that robust HVAC system. If you cannot use a HEPA filter in your house, what you want to use is what's called a MERV filter, M-E-R-V, and look at MERV filtration numbers, and use the higher the number, the better filtration. So the higher number you can get close to HEPA filtration efficiency. Probably won't get totally that HEPA filtration efficiency, but you can get close. You also want to make sure that you change these out on a regular basis. Some experts are saying every month or every couple of months, especially during the pandemic, to go ahead and change them out to make sure. So yes, again, air conditioning, if the system's not set up appropriately, it could certainly harm you, or not harm you, but cause more issues with coronavirus, because it's recirculating that air where the virus might be in. Simple solution there is open a window if you can. If you do get a good filtration system with good ventilation, it could certainly help out. Thank you.
Is hair loss an effect of COVID-19?
You know, hair loss is one of the symptoms that we're seeing in COVID-19. And an actress just came out saying, I had COVID-19 and now my hair is falling out. We're not exactly sure why that is happening. I think it might have something to do with the immune system and the way it's attacking different parts of the body. In this case, it's attacking the hair follicles, making the hair fall out. Thinking is that the hair will return itself, but at the same time, what we're learning here is, and the last count I saw, there were around 100 different unique symptoms with COVID-19 that we did not know about even a few months ago. And if you remember, back in February, March, April, we were talking about fevers, cough, shortness of breath. That was the original sign and symptom of coronavirus. Then we started talking about loss of sense of smell or loss of taste. Then we started talking about abdominal pain, diarrhea, vomiting. Then we started talking about maybe numbness and tingling in different parts of the body, neurological issues. And then we started talking about, so as you can see, we're learning as time goes on, we get more numbers of people that are affected and more long-term recoveries from that. We're finding out more and more issues that are going on. And so uniquely, it's hard to say exactly what symptoms in a general population you might have. And so what I typically tell people is, you know your body, you know what you've been exposed to or where you've been. If you think you've been exposed to COVID-19 and you're having symptoms that are odd for you, then you should get that checked out.
How many hours or days after exposure will a COVID-19 test show positive?
So the question is, how many hours or days after exposure will a COVID-19 test show positive? And there's no one answer for this, because it depends on the individual, your immune system, and your exposure load. When you get exposed to what's called a viral load, and that's essentially when you're around somebody with coronavirus, with COVID-19, that SARS-CoV-2 virus that's out there, when it gets into your body, if you get a small amount, you're going to have a small reaction to it, and it's going to take a while for it to build up in your body and a while to detect on these tests. If, on the other hand, as healthcare workers, if you're around people that are coughing or sneezing right in your face and you get that high load, that high viral load, then chances are you're going to get symptoms very early, and you're going to start getting positive on the test very early. Typically what happens is with coronavirus, most people, 50% of people get symptoms about a 5-day point. Almost everybody gets symptoms by 12 days. Usually a day or two before you get the symptoms is when you can start detecting coronavirus. So again, there's no one answer for everybody, but it looks like anywhere from 3+ days to detect the coronavirus on these tests.
Is it possible to get coronavirus from fast food like takeout or ice cream?
And this is a question that's been going around since February, since I've been answering questions. And can you get it from fast food? Can you get it from ice cream? Can you get it from food containers? Theoretically, you can get it from these issues. And it's not from the packing or what happened at the plant or the manufacturing process. It's from whoever was putting it together for you. If they were sick, if they were not taking appropriate precautions, and let's say somebody sneezes on your food and then you get the the food, you potentially could get it. However, if it gets into your stomach, it gets neutralized. It has to get into your respiratory tract, meaning it has to get the back of your throat, what we call the oral pharyngeal area of your body, and then it can attach to the cells there. So, breathing it in is much more bigger of an issue. If you touch the food, touch your eyes, your nose, or your mouth, potentially could get it that way as well. But for the most part, you don't have to worry about food or the containers it comes in. But typically what I tell people, especially if you're doing takeout, get the food, take it out of that container, put it in a separate container, wash your hands, throw all the containers away, wash your hands, and then go ahead and eat your food that way. Should be a minimal concern. Again, unless the person preparing it is sick, which is why if you're sick or if somebody's preparing your food, you notice they're sick, please ask them, don't prepare my food. You need to go home, my friend, because you're going to get other people sick.
Can children under the age of 12 transmit or be carriers of COVID-19?
So can children under the age of 12 transmit or be carriers? The answer is yes, they can be. One thing we're finding out is the younger children are, the less likely they are to get complications from coronavirus or potentially spread coronavirus. But we're also finding out that children have as high, if not higher, viral loads, which I just talked about, of the virus in their nose. And that means that they have the potential to transmit it more. However, there's a couple of things going on. If you think about it, children tend to not be as close to adults constantly as adults are to each other. On top of that, when you're next to an adult, you're typically at almost equal levels. So if somebody's breathing near you and their mouth is around this area, if somebody's coughing or sneezing around you and they're not 6 feet away, they're going to be close to your level. So that virus is going to stay up in the air for you to breathe it. Children tend to be shorter, and so they aren't necessarily going to be breathing in an area where you might be breathing in that air. And so we think that might have something to do with it. But bottom line, this is what I say all the time. Children don't necessarily get coronavirus, have complications from it, or pass it on as much as adults, but that doesn't mean they don't get it because they do. That doesn't mean they don't have complications because they do. And that doesn't mean they don't pass it on because they do. So even with children, you need to be extremely careful about, again, the 3 W's. Wear a mask, watch your distance, and wash your hands.
Why has hydroxychloroquine been disregarded?
So the question is, why has hydroxychloroquine been disregarded? And the reason behind this question is, if you remember back in March, April timeframe, hydroxychloroquine has been touted as something, the first medicine we have that actually can treat coronavirus and can save lives. That came from a very, very small study that was done with a handful of patients, couple handfuls of patients, where the physician, it was not a controlled study, it was an observational study. He saw his patients getting better, that he put on hydroxychloroquine, but he put them on other medications as well, and the population the study wasn't done in a fashion that studies are typically done in, where we can get good, robust information. Since then, subsequent studies, especially the larger studies, have shown no real benefit for hydroxychloroquine. And the issue is hydroxychloroquine does have a known side effect in particular that is of concern, and that's cardiac arrhythmias, especially if it's combined with another medicine that could cause cardiac arrhythmias, azithromycin, which is an antibiotic, and for a while they were combining the two of them. So because of these studies looking at it, and overall looking at the larger studies that are what we call robust studies, peer-reviewed, that have been controlled studies, looking at people that got it versus people that didn't get it, they found that it does not seem to help, and it does seem to have side effects. And so for the most part, the hydroxychloroquine has been taken off the shelf, saying it doesn't look like it's working for coronavirus at this point, especially for people that are sick or critically ill. It doesn't seem to help them and does have some issues that could cause concerns, so we want to be extra careful.
Does hand sanitizer work just as well as just washing your hands? So
the question is, does hand sanitizer work just as well? And the hand sanitizer we're talking about are these alcohol-based hand sanitizers with at least 60% alcohol. The common thought here is that if you can get to a sink and you can use soap and water for 20 seconds, that's the best way to wash your hands, because it gets rid of the viruses, gets rid of the bacteria, it gets rid of the grime and dirt that might be on there as well. But in between those times when you can't get to a sink or a water source, or you don't have soap, then using alcohol hand sanitizer can certainly get it under control. But with alcohol hand sanitizer, one thing you want to be very careful of is sometimes people will do this, they'll put just a little bit on, they'll rub it together, and they'll let it air dry. No, you want to keep rubbing it together for 20 full seconds until it dries while you're rubbing it, all between the fingers. Make sure all the fingers, the finger webs, everything else is hit with the hand sanitizer, and that's the way you disinfect your hands. So for the most part, if you can get to a sink with soap and water, that's the best thing to do. In between, using hand sanitizer, especially when you're on the go, is a definite good substitute.
In your opinion, how long do you think we'll be dealing with COVID-19? Into 2021 or longer?
So how long will we be dealing with COVID-19? I don't think COVID-19, and some experts have backed me up on this, I don't think COVID-19 is going to go away, as in we'll get to one point where we say there's no cases of COVID-19, it's eradicated, it's changed, and we don't have to worry about it anymore. I think what's going to happen is we're going to get to the point where it doesn't affect us nearly as much, and that means herd immunity, meaning we need a certain number of people that are immune to it, either from getting the infection and having a built-up immunity that lasts, which we don't know if it does at this point, or getting a vaccine, or maybe multiple vaccines with booster shots. Once we get to that level, then we'll be in a situation where it's more under control, similar to the flu. The flu will never be eradicated, but we keep it under control with vaccines and other measures we take. And so I think we'll see lives go back to a near normal, maybe not completely the way it was before, but close to normal once we get there. My guess is that's still another year, year and a half, maybe even 2 years away at this point, because we need to get the vaccine, need to get enough people vaccinated to get this under control. And right now the vaccine looks like maybe beginning of the year, maybe springtime is what a lot of people are saying, a lot of experts are saying right now. But even though it does come out, remember, we're going to have limited doses initially, they'll eventually build up, but there are a lot of people right now that are saying they're hesitant to get the vaccine. Time will tell how many really are, but we need a certain percentage, and they're saying 50 to 70% of the population, not just here, but globally, needs to get vaccinated or immune through exposure to make sure that we do have this under control. So we're still a ways to go from there. Again, I don't think it'll ever go away, but I think it'll get under control within the next year or two, hopefully. But thank you for your questions, always fantastic, and I appreciate them. Going over the headlines again, saliva test, Yale School of Public Health just came out with a saliva test protocol they're giving free to other universities and labs. They can start using agents and machinery they have on hand already. So within a couple weeks we should start seeing a lot more testing, and it's very inexpensive to boot, and it looks like it's as accurate as all the other tests that are out there. CDC immunity, they're not saying you're immune for 3 months. They're saying you shouldn't get retested for 3 months because you could test positive and it could be a false positive once you've been exposed to COVID-19. And then challenge trials. Trials where we deliberately infect somebody with COVID-19 to test, see if the vaccine is working. Those are not being done right now. And most ethics professors, ethics experts are saying should not be done at this point. But again, thank you very much. Hope you have a fantastic week. And as always, I hope you, your family, your loved ones, and your community stay happy and stay healthy.